Hi everyone, let me prepare the material. Hope people hear me better. I use the bell microphone. Okay, so today we talk about pathology. So technically, I just want to review things. Uh, So please give me a second. You hear me well? Testing, testing. Testing, testing. Do you hear me well? Hello? Do you hear me? Okay, I think so. So now let's start. So let's say last time, maybe I need to read again yesterday. Give me a second, please. We talk about types of necrosis. So coagulation necrosis and liquefactive necrosis, cases necrosis, fat necrosis, fibrinoid necrosis, and then after that talk about liver, so on and so forth. Now types of necrosis. Coagulation necrosis result often from the sudden cut-off of the blood supply to an organ. For example, ischemia. That's the coagulation necrosis. Definition of ischemia: a decrease in arterial blood flow. In ischemia, there is no oxygen, therefore lactic acid builds up and leads to coagulation necrosis. Gross manifestation of coagulation necrosis is infarction. Under a microscope, looks like cardiac muscle, but there is no striations, no nuclei, dry red, no inflammatory infiltrate, all due to lactic acid that has a denature and destroy all the enzymes, so cannot be broken down. Neutrophils need to come in from the outside to break down. Therefore, vague outlines coagulation necrosis. So Pale versus hemorrhagic infarctions. Look at consistency of tissue. So good consistency. So closely look pale infarct. Heart, kidney, spleen, liver, regardless of the organ, to infarct because a dual blood supply, such as coagulation necrosis, example of a pale infarction of the spleen, most likely due to emboli from left side of heart. Causes of emboli. So vegetations rarely embolize in acute rheumatic endocarditis, infective endocarditis, mitral stenosis. Heart is repeatedly attacked by group A beta hemolytic stress and clots thrombi, the worst arrhythmia associated with embolization in the systemic circulation is AFib because there is stasis in the atria, clot formation, then it vibrates, little piece of clot embolize. So gangrenous necrosis, dry or wet gangrene. Picture of the dry gangrene, not wet gangrene because there's no pus. Occurs in diabetics with atherosclerosis of popliteal artery and possible thrombosis. Dry gangrene-related coagulation necrosis related with ischemia. Definition of ischemia: decrease in arterial blood flow, which is due to atherosclerosis of the popliteal artery, pathogenesis of myocardial infarction, coronary thrombosis overlying the atheromatous plaque, leading to ischemia, and lumen is blocked due to thrombosis. Most common cause non-traumatic amputation. Diabetes because enhanced atherosclerosis, popliteal artery, dangerous artery. Coronary is also dangerous because small lumen. So, now in wet gangrene is complicated by infective heterolysis and consequent liquefactive necrosis. Now talk about loose consistency of tissue. It's a good consistency tissue now. Loose consistency of tissue. Hemorrhagic infarct. Bowel testis. Torsion of the testis, especially the lung, because it has a loose consistency, and when blood vessels rupture, red blood cell will trickle out, leading to hemorrhagic appearance. Example: hemorrhagic infarction of small bowel due to indirect hernia. So second most common cause of bowel infarction is getting a piece of small bowel trapped in direct hernia sac. Most common cause of bowel infarction is adhesions from previous surgery. Example: in the lung hemorrhagic infarction, wedge the shape when to pleural surface, therefore have effusion and exudates. Neutrophils in it have a pleuritic chest pain, knife-like pain on inspiration. Pulmonary embolus leads to hemorrhagic infarction. So pulmonary embolus will lead to hemorrhagic infection. So pulmonary is a hemorrhagic infection. Okay. Now talk about liquefactive necrosis. Exception to rule now coagulation necrosis. Seen with infarctions of the brain. Most common signs of infarction from carotid artery. When we listen for the brute, so hearing for a noise that is going through a vessel that has a narrow lumen placed with thrombus develops over atherosclerotic plaque and leads to stroke, leads to transient ischemic attacks. Is a little atherosclerotic plaques going to little vessels of the brain, producing motor and sensory abnormalities that go away in 24 hours. Brain with mesh work in brain astrocytes is analogous to the fibroblast because of protoplasmic processes. Therefore, actin-like fibroblasts cannot make collagen, but its protoplasmic processes give some structure to the brain. Therefore, infarction of the brain basically liquefies it, has no stroke, and you see a space, so liquefactive necrosis. Therefore, exception to the rule of infarctions not being coagulative necrosis is the brain and it undergoes liquefactive necrosis. No stroke, therefore, leaves a hole. Cerebral abscess and atherosclerotic stroke both are liquefactive necrosis. So, liquefactive liquefies think neutrophil because their job is a phagocytosis with their enzyme to liquefy. Liquefactive necrosis relates to an infection with neutrophils involved, usually acute infection producing an abscess or an inflammatory condition which liquefies tissue. Therefore, liquefactive necrosis usually applies to acute inflammation related to neutrophils damaging the tissue. Exception to the rule, liquefactive necrosis related to infarct, not an inflammatory condition. It just liquefies. Slide shows liquefactive necrosis due to infection in the brain. So, if you infect the brain or have an infection or have an abscess, it is the same process, liquefactive necrosis. Example, abscess, gram-positive causae in clusters. Why are they in clusters? Coagulates, which leads to abscesses. With Staphylococcus aureus, coagulates converts fibrinogen into fibrin, so it localizes the infection. Fibrin strands get out, so resulting an abscess. When the stress releases hyaluronidase, which breaks down GHGs in tissue, and infection spreads through the tissue to cellulitis. From point of view of necrosis, neutrophils are involved, therefore, it is a liquefactive necrosis. Example, abscess, so lung yellowish areas, high fever, and productive cough. Gram stands for gram-positive Staphylococcus, which is strep pneumonia. So most common cause of bronchopneumonia, not hemorrhagic because it's pale and wedge the shape necrosis at the periphery, which leads to pleuritic chest pain. Example: patient with fever, night sweats, weight loss. So this TB for sure, tuberculosis, Mycobacterium tuberculosis, which has granulomatous caseous necrosis. Okay, talk about caseous necrosis. Pathogenesis of granuloma involve interleukin 12 and subset of helper T cells and positive PPD. Now talk about cases, Jesus, consistency, necrosis. Either have mycobacterial infection, GTB. Any infections include atypicals or systemic fungal infection. These are the only things that will produce caseation in the granuloma. There is a lipid in the cell wall of the organisms leads to cases appearance. Sarcoidosis get granulomas, but they are not cases because they are not mycobacterium or systemic fungi, hence non-caseated granulomas. How about Crohn's disease? Yes, granulomas, but not cases because not related to mycobacterium or systemic fungi. Now talk about fat necrosis. Enzymatic fat necrosis, unit 2, pancreas. Example, patient with epigastric distress with pain radiating to the back, pancreatitis, cannot be peptic ulcer the diagnosis. So because pancreas is retroperitoneal, therefore just have a epigastric pain radiating to the back is a type of enzymatic fat necrosis. Therefore, necrosis related to enzymes. Enzymatic fat necrosis is unique to the pancreas because the enzymes break down fats into fatty acids, which combine with calcium salts, forming choking wide areas of enzymatic fat necrosis. Choking wide areas due to calcium bound to fatty acids. Saponification, which is soap like salt formation. This can be seen on X-rays because of calcium in them. Example, a patient with pain constantly penetrating into the back show X-ray of right upper quadrant. Diagnosis is pancreatitis and especially seen in alcoholics. So histo slides on enzymatic fat necrosis, Lewis discoloration, which is calcification. Types of dystrophic calcification of damaged tissue. So what enzyme would be elevated? Amylase and lipase. Lipase is more specific because amylase is also in the parotid gland, small bowel, and fallopian tubes. What types of necrosis? Another example enzymatic fat necrosis. Underlying cause, alcohol produces a thick secretion that will lead to activation of enzymes, will lead to pancreatitis. Therefore, whenever you see blue discoloration and atherosclerotic plaque in a pancreas, it will be calcium. Blue discoloration and atherosclerotic plaque in pancreas, it will be calcium. Traumatic fat necrosis. Example, woman with damage to breast is traumatic fat necrosis, not enzymatic. It can calcify, can look like cancer on mammogram. Differentiation between that and differentiated between that and calcification in breast cancer is, painful. So cancer which is painless. Traumatic fat tissue usually occurs in breast tissue or other adipose tissue. So traumatic fat necrosis so distinguished with the cancer. So cancer which is painless. This was very painful. I'll talk about so fibrinoid necrosis. Always means looks like but isn't. Therefore looks like fibrin but it's not fibrin. Fibrin. Okay. That is a necrosis of immunologic disease. Examples of immunology disease, palpable purpura, which is small vessel vasculitis, which is immune complex type 3. So fibrinoid necrosis as an immune complex deposition of small vessel, pathogenesis of immune complex, damage of type 3 hypersensitivity. So an immune complex is antigen antibody circulated in the circulation. So it's deposits whenever circulation takes it. Example, glomerulus, small vessel, wherever. So it activates the complement system, the alternative system, which produces C5a, which is chemotaxis to neutrophils. Therefore, damage done as a result of type 3 hypersensitivity is done by neutrophils. And they are there because the immune complex activated the alternative complement system. The complex has little to do with the damage. So it's the neutrophils do eventual damage. I'll talk about henoch purpura. Few persons legs and see palpable purpura due to type 3 hypersensitivity reaction, rheumatic fever, so vegetations of the mitral valves have a fibrin-like fibrinoid necrosis materials, necrosis of immunologic disease, morning stiffness, rheumatoid arthritis, fibrinoid necrosis because immunologic damage. Therefore, fibrinoid necrosis is necrosis of immunologic damage. In vessel, it's a vasculitis. In kidney, it's a glomerulonephritis. And in lupus, glomerulonephritis involving immune complexes. Now, liver, triad area, portal vein, hepatic artery, and bile duct. Portal vein, hepatic artery, and bile duct. So liver is a unit because it has a dual blood supply. So hepatic artery and the portal vein will dump blood um, into sinusoids. Okay, so give me a second. So other examples of sinusoids organs are bone marrow and spleen. Characteristics of sinusoids, gaps between endothelial cells with nothing there, so things can fit through. Things like red blood cells and inflammatory cells. So GBM is fenestrated. So have a little tiny pores within the cells for filtration. Sinusoids have a gap so large cells can get through them, not through with the GBM because it is intact. And little pores allow filtration. Portal vein blood and hepatic artery blood go through sinusoids and eventually taken up by central vein, which becomes a hepatic vein. The hepatic vein dumps into the inferior vena cava, so which goes to the right side of the heart. Therefore, there is a communication between right heart and liver. Right heart failure, blood fuels the high fail heart. Therefore, the liver becomes congested with blood, leading to nutmeg liver, also known as congestive hepatomegaly. So, if you block the portal vein, nothing happens to the liver because it is before the liver. Blockage of hepatic vein leads to Buscheri and liver becomes congested. Which part of liver is most susceptible to injury normally? Around central vein because it gets first debris on oxygen coming out of the sinusoids, which is zone 1. Zone 2 is where yellow fever will hit, mid-zone necrosis due to Egypti. Zone 3 around portal vein, which will have least oxygen analogous to renal medulla, which only receives 10% of blood supply, and the cortex receives 90%. Fatty change is around zone 3, part around central vein. Therefore, when asking about acetaminophen toxicity, which part is most susceptible? Then around central vein, because it gets least oxygen and therefore cannot combat free radical injury. Now, alcohol-related liver damage. Most common cause fatty change, alcohol. Metabolism of alcohol, NADH and acetylcoenzyme A. Acetase is a fatty acid and acetylcoenzyme A can be converted to fatty acids in the cytosol. NADH is a part of metabolism of alcohol. Therefore, for biochemical reactions, what causes pyruvate to form? Lactate in anaerobic glycolysis. NADH drove it in that direction. Therefore, always see lactic acidosis, a form of metabolic acidosis in alcoholics because increased NADH drives it in that direction. Also, in fasting states, alcoholic will have a trouble making glucose by gluconeogenesis because need pyruvate to start it off. However, you have a lactate and not pyruvate. Therefore, alcoholics will have a fasting hypoglycemia. Acetylcoenzyme can also make ketone bodies, which is acetylacetylene coenzyme A. So HMG coenzyme A and beta hydroxybutyric acid. So see beta hydroxy butyric ketone bodies in alcoholics because it's a NADH driven reaction. Therefore, two types of metabolic acidosis seen in alcoholics are lactic acidosis because driving pyruvate into lactate and increased synthesis of ketone bodies. because excess still consumes main keto acid, beta hydroxy, pu- butyric acid. Why does it produce fatty change? In glycolysis, Rao reaction 4 get intermediates dihydroxyacetone phosphate NADH reaction and is forced to become glycerol 3 phosphate. Beta board question with glycerol 3 phosphate subtle. So get ATP also important carbohydrate backbone for making triglycerides, S3 fatty acids to glycerol 3 phosphate, and you get triglyceride. In liver, the lipid fraction is VLDL, endogenous triglyceride is synthesized in the liver from glycerol 3 phosphate derived from glycolysis. So restricting fat will not decrease the synthesis of VLDL. Restricting carbs will decrease the VLDL synthesis because it is glucose intermediate is made from. Glycerol 3-phosphate is product of glycolysis, which is why fatty liver is most commonly due to alcoholism. So this reaction. Now, what's your call? Liquid fatty chain, the mechanism when you make VLDL and to be able to get it out of the liver, the VLDL must be surrounded by apoproteins. In washiorkor, there is decreased protein intake. They have an adequate number of calories, but it's on caps. Therefore, they cannot be they cannot get VLDL that they make in the liver because there are no apoly, a, apolipoproteins. So to cover it and put it out in the bloodstream and solubilize it in water. Lipid and water do not mix. Therefore, it is necessary to put proteins around the lipid to dissolve it in water. Therefore, the protuberant abdomen in these patients is there for two reasons. Decreased protein intake, which decreases oncotic pressure, leading to acidosis. So the biggest reason is that they have huge livers related to fatty change. Mechanism for fatty change is different from alcohol because in alcohol the mechanism is due to increased synthesis of VLDL. In this case, there is a lack of protein to move around VLDL and export it out of the liver. Now, hemosiderin and ferritin. Brief discussion: ferritin, which is soluble form of circulating iron, and is a good marker for iron in bone marrow. It is a test of choice in diagnosing any iron-related problem, iron deficiency anemia or anemia of chronic disease or iron overload disease, so such as hemochromatosis and hemosiderosis, so would be elevated. Ferritin is a soluble form of iron, circulating iron, while hemosiderin is an insoluble form of iron storage. So circulating iron, so that's a soluble. That's why circulate. And iron storage, which is insoluble. So insoluble, which is circulating, they call ferritin. But for the insoluble form, of iron, iron storage, they call hemosiderin. So, and this is storage in the macrophages and bone marrow. Stand it with the Prussian blue. Okay, that's about it for now, huh? Okay, thank you. So we can stop now.